experience, I know how important the public mental health system is for individuals with serious and persistent mental illness. I receive services ranging from assertive community treatment, case management, peer support, clubhouse, and other services. They have literally saved my life. Without the services that I received through community mental health, I would have died by suicide. Previously, I was employed as a registered nurse, and I had health insurance through my employer. In 1996, I had a severe episode of bipolar depression and required outpatient treatment and several hospitalizations and a psychiatric unit. Despite receiving treatment from a private psychiatrist and private psychotherapist, my symptoms increased. My depression, my anxiety, and my panic attacks were even worse than what you saw. The psychiatrist had a very difficult time trying to find an effective combination of medications to treat my symptoms. This resulted in several medical leaves of absence. My last medical leave of absence was without pay. Eventually, I had to resign from my position because it was not known if or when I could return to work. I exhausted all my savings. I cashed in my retirement plan. It didn't take long to become financially destitute. I was on the verge of becoming homeless. My depression and anxiety spiraled, and I attempted suicide. Subsequently, I was referred to Oakland County Community Mental Health Authority. I was authorized to receive intensive services. And these services were sort of community treatment where they saw me at my home. They were available 24/7. The case managers helped me apply for Social Security disability benefits, Medicaid, and food stamps. They linked me with a program that subsidizes my housing. These services literally saved my life. After receiving ACT services for several years, I became stable enough to be transitioned to a less intensive case management program. During my lifetime, I've had about 16 psychiatric hospitalizations. I have not had any psychiatric hospitalizations in more than a decade. Because of the services that I received. Traditional mental health services were not adequate to help me. It was the specialty mental health services that literally saved my life. I'm grateful that even though I wasn't eligible for full Medicaid, I was able to receive the specialty mental health services I need. Please make it a priority to properly fund the public mental health system. Thank you.
Hello, my name is Dave Bennett. I was hopeless living in homeless shelters. I was referred to CNS and started seeing a doctor on a regular basis and was able to find the right meds to help my mind slow down so I can begin to think clearly. I was assigned a wonderful case manager who linked me to Visions Clubhouse. While at Visions Clubhouse, I started to volunteer in the kitchen. The more I volunteered, my self-confidence grew. Through this, I have been able to socialize and make new friends with the support of the clubhouse. I was able to become my own payee again and find my own place. I am able to have a garden again, cook for myself, enjoy society activities. And the best part, I feel that I can start doing what I truly love and skilled at, is making custom carpet mats again. Now I have sense of belonging and a peace of mind. Thank you for listening.
Hello, my name is Barbara Fuller, and I am from Frames Unlimited Clubhouse through Easter Seal. I have been part of the Oakland County Community Mental Health Authority system for approximately 30 years. Throughout my life, I have suffered from mental illness. I've been depressed most of my life, and I am just bringing myself up from that right now. My greatest fear is that I will begin to become suicidal once again without the support provided by community mental health, and that I will lose my house and currently receive public financial assistance through Medicare and have a spend-down deductible that I must reach before my mental health services are paid for. As of October 3rd, 2016, I will no longer qualify for CMH services and have no way of reaching my spend-down and have to pay out of pocket for many things that I cannot afford and things that food stamps are currently paying for. Since I just turned 65 this year, I no longer qualify for the Freedom to Work Medicaid program and don't have that as an option in order to continue to receive Medicaid. To me, this is another closed door for me getting the desperate help that I need. I feel like my world is crumbling, or collapsing, I'm sorry, and that I will once again become suicidal and end up homeless. Clubhouse services have played a great role in helping me to stay out of the hospital. If I am no longer able to attend and have a constructive way to structure my life, I'm sorry. I know that I will become more and more depressed and end up back in the psychiatric hospital. This is my story, but I know that there are many others with a similar story, so I beg you to reconsider, one, to properly fund mental health services, and two, to oppose Lansing's effort to shift Medicaid funds to mental health services to provide HMOs where the focus will be on profits first and not my mental health needs.
My name is Julian Wainwright. I'm a parent of this 24-year-old. Please stand up. Stand up. This is Aislinn. We're talking about health care and so on, and HMOs. This is the current predicament we have. We got word that the HMO, for whatever reason, kicked our primary care physician off the list. My daughter started having seizures 5 years ago. She's on a medication called Keppra. We can't follow the script because it's taken them over a week and they haven't rectified the problem. So when you want to hand over the decision making to HMOs, it's insanity. Because what the lady in the doctor's office told us is this sometimes and often happens. We don't know why. They just kick them off. You know what they did? They denied the primary care physician we have, and they assigned us some primary care physician in Petoskey. So what the heck does that help? The bottom line is, you know, there's an anxiety that every one of us as parents with special needs, people with challenges have. You just don't know. It's tough enough dealing with trying to help your child or your brother or your parent, whatever it is. You cannot add to that, as Carolyn said, you know, we have to use the power of our vote, and we will do so. But it still comes down to you guys who are in the legislature, and you have to look in the mirror. And that's why I asked you, stand up, Aizen. Did it stand? Stand up, sweetheart. Stand up, sweetheart. Come. You have to look at that face. And if your vote denies her, it's on you. It's on you. And she's not alone. There are plenty of people like her. So that's what I want to say to you. Think and vote and be smart. These are people. These are not figures. It's not the money. There is money. It's how it's used. So you as the decision makers have the power.
Hello, my name is Susan Hatcher, and this is my husband, Doug Hatcher. We are the loving parents who had hopes and dreams for the future of our son, who is now age 38. To our shock and dismay, he developed severe mental illness and bipolar disorder in his early 20s. As a result of this impairment, he made poor choices, resulting in risky behavior while going undiagnosed and untreated. With his mental illness raging out of control and untreated, our son committed several non-violent crimes. Professionals believe that he committed these crimes in order to self-medicate. Since we were inexperienced parents with the disease of mental illness and bipolar in particular, we tried every possible means to secure help from many different organizations and agencies, even going so far as to encourage our son to complete the adult treatment court program supervised through the Honorable Joan Young, which was regrettably unsuccessful and disastrous. Due to the nature of his illness, he could not comply with the rules that were enforced and required, such as maintaining regular employment and providing rent for an apartment as well. Our son lied to the probation officer about working and losing his job because he was afraid of court consequences. It was during this time that his probation officer charged him with a probation violation, and Joan Young imposed the original court sentence and put him in prison. While in jail and prison for 18 months, he went untreated, without medication, and his condition was worse than ever after being released. As a condition of his release from prison, he was ordered by the parole board to get and receive proper mental health treatment. Since our son was without health insurance and had no income, we were instructed to contact the organization called PACE, who denied him the funding for any mental health treatment, even though it was a condition of his parole. During this time, our son severely floundered, and it took his parole officer over a month for PACE to accept him and eventually refer him to receive help through the organization of CNS. After trial and error with many different medications, we found that lithium and Wellbutrin have kept him more stable and suppresses the need for him to self-medicate. Since he committed nonviolent crimes during this time, his mental health issues were untreated. His past activities have prevented him from securing safe and affordable housing through using his Section 8 voucher. We have tried unsuccessfully to find an apartment that would take Section 8, only to find one apartment in a 2-year search, and then found out he would be denied because of his criminal background. Finding an apartment that he would qualify for and in a safe environment is next to impossible, as most apartments would not accept Section 8 vouchers. We have reached out to legal aid and advocacy groups only to be told there was a cut in funding and he wouldn't qualify anyway due to his 2 felonies and 3 misdemeanors. The advocacy group suggested he appeal any denial from any apartment complex, which could take years. As parents, we are wondering what can be done to help our vulnerable son and disabled people like him who commit nonviolent crimes before being diagnosed and treated. We are appealing to try to get some kind of legislation or amendment of a bill to help people like our son who have committed these nonviolent crimes to obtain housing that would allow him to live safely and independently with help from his small SSI income. We find that the resources available are extremely insufficient. There needs to be a greater effort to provide better mental health services, both through organizations like CNS or New Oakland Family Services for the good of our community. There is also a great need for private psychiatrists and therapists who now refuse to take Medicaid. We greatly appreciate any help or suggestions you can do for us in our time of need from the bottom of our hearts. Thank you.
I'm Bob McGreevy. I have a son in the mental health system. Yes. When I hear a testimony like that, it tells me that we need to start voting in our own best interests and making some changes, because something is certainly not working for any of us. I have a short experience that I'd like to share with you. My wife and I have testified 2 years in a row in Lansing before the House and the Senate Appropriations Subcommittees. Now, just being in those rooms, if you have any heart at all to you, it would bring you to tears to see. It's like some of what we've shared here tonight and heard testify. I watched a little girl come up on a walker, and she was so handicapped that it took 2 people to help her get out of the walker and sit down before a microphone at a table. And I watched her beg that legislature not to take any more away from her, because she could just barely live on what she had. Now, I am sure that by the time we got out of that room over there, they either hit the delete button or the round file with our testimony, and that's how much they really care about us. Now, I've been assured here tonight that this testimony will not be deleted. This is going to be a record that's going to stand, that the legislatures that we have here are going to be able to take this and use this to fight the battle to help us. Now I'll go to my statement that I came up here to make. I have a son in the community mental health system. He has lived independently for 30 years. Due to budget cuts from Lansing, he is back in our home. Governor Snyder and the legislature are hurting the disabled. My son was in a portable supports shared apartment program with a 90% success rate. He was stable beyond all expectations for 12 years. He received treatment costing about $1,800 per year and enjoyed a $4,200 per year housing subsidy. Budget cuts from Lansing closed the perfect program, dumped 30 clients to the street. Why would you close a perfect program that saves money? Our son is now being treated in the revolving door of court-ordered commitments and premature releases. The 3rd time this year he was hospitalized, he was so sick both mentally and physically that he almost died. Closing a portable supports program, which treated our son for $1,800 a year versus $180,000 a year in court-ordered hospitalization, sounds like we need a CPA that can add. Where is the savings? Governor Snyder's budget plan cut the budget to community mental health. The plan was cause it to fail, use the plan failure for an excuse to privatize, integrate mental health funds. Budget cuts hurt our mentally ill son. The result of Governor Snyder's budget cuts, our son lost affordable housing, a $4,200 per year housing subsidy. He is back in our home after 30 years, which the counselors 30 years ago said you got to use tough love, push him out, make him live independently so he can survive after we're dead. Closed the perfect program, dumped 30 people to the streets. We lost CLR's workers, community living support, lost transportation. He was denied treatment at one point to where he decomped 75% below his baseline. They just ignored him, stayed away from him for 3 months and never went near him. What we are doing is creating more hopelessly homeless people. Governor Snyder's plan to privatize, integrate the $2.2 billion mental health budget. The plan is cut 40% off the top, turn the remainder over to private industry, the insurance companies that take their cut, which I heard here tonight was maybe another 20 or 30%. That's not leaving much of a $2.2 billion budget. This is an illusion of progress, a crisis in the making. Another money grab that will close the doors to community mental health as we know it today. I am afraid to die, leave my son in a broken mental health system, a system designed to fail. I am afraid to die and leave my son at the mercy of 5 insurance companies that are nothing but profit driven.